And why couldn't they hold off on these cuts?
Well, it's kind of the cruel irony of this pandemic that we're seeing physician groups, we're seeing hospitals have to cut back on what are seen as non-urgent, non-essential procedures. They're not performing cardiovascular surgeries, orthopedic surgeries. Just billings across the healthcare sector are way down despite this immense demand for actual emergency treatment for people with COVID-19. So the revenue streams have essentially fallen off a cliff, and that has meant that physician groups and hospitals have had to essentially give frontline healthcare workers who are treating people with coronavirus a pay cut, or at least a benefit cut. So there are hospitals that have deferred salary payments. There are physician groups that have cut off 401k contributions and paid time off and discretionary bonuses. So even as some doctors work in emergency rooms treating people with coronavirus, they're seeing a cut to their compensation.
Yeah, no, it's not what you want. I mean, it's not what I think we want as the public. I'm sure it's not what the hospitals want. Is there more money coming from the federal government or somewhere? I know some was already allocated to help them through this period, but these cost cuts, layoffs, benefit reductions suggest it's not enough.
Well, I think there's a lag in the $100 billion that you're alluding to that Congress set aside for hospitals and other health systems to essentially keep them afloat through this pandemic, understanding that we can't afford to have hospital closures and health clinic closures as, you know, there is this immense urgent demand for people who want to get tested and for people who are in respiratory distress and actually need urgent treatment for coronavirus. But there's obviously been a lag, and it's impacted a lot of these health systems. And that's why you're seeing cuts to compensation. You're seeing in some places furloughs, workforce reduction plans. Some places are ceasing to use contract workers or hourly workers and relying instead solely on their salary workforce. So we'll see what happens in the coming weeks. Obviously, it doesn't seem like it's imminent that hospitals and other health systems are going to be able to resume those, lucrative but not necessarily urgent, meaning needed this week or tomorrow procedures that keep them afloat during, more normal times.
One related question to that is how hospitals across the country are faring. So those that have seen what's happened in New York or maybe Washington State, were they able to better prepare to kind of either handle what could be an influx of coronavirus patients or just prepare for having to shut down these elective procedures and all of those sorts of things?
I don't know that state by state I could necessarily give you a trend of, who's been better prepared, who's been worse prepared. We're seeing across the country hospitals struggling just to keep folks supplied with masks and other personal protective equipment. Obviously, the ventilator question has been a huge one. We have seen the federal government really take very dramatic steps to scale up capacity in New York City and Los Angeles. You have these hospital ships that President Trump continues to talk about. We have field hospitals in New York City popping up. So, there does seem to be a lifeline for hospital capacity in some states, but we're also seeing anecdotal reports, of shortages of ventilators and, the personal protective equipment issue and, seeing the New England Patriots, their airplane landing back on American soil, transporting masks. That was really, I think, telling of the situation that a lot of hospitals are in.
Crisis or not, you can't call them the New York Patriots, Lev.
I'm from the West Coast, and the Oakland Raiders have moved away, so no more NFL for me.
They are the team favorite in my house. Long story. Lev, it's good to see you. We appreciate it very much.
Thanks for having me.